One thing that is not being covered that much is the slow-moving destruction of this ridiculous myth about keeping your private health insurance plan because we don't want to take the choice away from Americans. We don't want to take the choice away from fine Americans. We want them to have the choice to keep their amazing, generous, employer-based private health insurance industry. If you remember our friend, Mayor Mayor Pete Buttigieg, let's see what Mayor Pete had to say at the last debate about keeping the choice to this wonderful, wonderful plan to health care. What is he saying? It Medicare for all who want it. Some nonsense. Let's hear what Mayor Pete had to say.
Mayor Buttigieg, you say Senator Warren has been, quote, evasive about how she's going to pay for Medicare for all. What's your response?
Well, we heard it tonight, a yes or no question that didn't get a yes or no answer. Look, this is why people here in the Midwest are so frustrated with Washington in general and Capitol Hill in particular. Your signature, Senator, is to have a plan for everything, except this. No plan has been laid out to explain how a multi-trillion-dollar hole in this Medicare for All plan that Senator Warren is putting forward is supposed to get filled in. And the thing is, we really can deliver health care for every American and move forward with the boldest, biggest transformation since the inception of Medicare itself. But the way to do it without a giant multi-trillion-dollar hole and without having to avoid a yes or no question is Medicare for all who want it. We take a version of Medicare, we let you access it if you want to, and if you prefer to stay on your private plan, you can do that too. That is what most Americans want. Medicare for all who want it, trusting you to make the right decision for your health care and for your family, and it can be delivered without an increase
Senator,
on middle-class taxes.
So, Mayor Pete, who, by the way, I'm still not understanding. What is this man's qualification to run for president of the United States? I don't want to be an elitist jerk-off. He's the mayor of South Bend, Indiana. Sorry to my friends in South Bend, Indiana, but you're not exactly Chicago, Illinois, population-wise. It's not like South Bend, Indiana is some roaring metropolis. I speak with people there. It's gentrified like the rest of America. So, putting that aside, he never gets asked, what is your qualifications to run for president? Putting that aside, Mayor Pete keeps saying at these debates, Bernie, Warren, you're taking away people's choice. Why are you taking away people's choice? They want the choice to keep private health insurance. Well, I think what Mayor Pete might be misunderstanding is you don't have a choice with your private health insurance industry. And the Washington Post of all places, who has been pushing the fear-mongering for Medicare for all, saying Americans don't want it, it's going to be too expensive, it's not doable, people will have to wait for hours and hours, days and days, weeks and weeks for certain things. The Washington Post is now a case study in the fact that you don't have a choice. Here from a writer from the Washington Post just put this out there yesterday. The Post giveth and the Post shall taketh away. Days after announcing additional paid parental leave, great for fathers getting extended parental leave, company officials move staff towards high deductible health insurance plans that shift significant costs and risk onto the employees. Hashtag WAPO strong. Who owns the Washington Post? Anat? My girlfriend's here. She's sitting down. Jeff Bezos is his name? Oh. So Jeff Bezos owns the Washington Post. Jeff Bezos, who, mind you, how much does Jeff Bezos make a day? Just in his stock alone, Jeff Bezos makes over $100 million per day on stock options alone. But Jeff Bezos, he can't afford to pay those wonderful journalists at the Washington Post. You can't afford to give them good health insurance. So this is not me saying it. This is, by the way, this gentleman is a member of the Guild, the union that represents the Washington Post. So this choice that Mayor Pete and Joe Biden keep talking about, and Kamala Harris keep talking about, that Bernie and Warren, who pretends that she's for Medicare for all, but we all know she's not, this choice that we're ripping away from the fine folks at the Washington Post, no. It's companies like the Washington Post under Jeff Bezos, who are not giving their employees a choice. Because not that I'm, sitting here crying tears for the Washington Post. They're doing just fine in terms of their earnings at the Washington Post. Journalists there. But they don't have a choice. Like any other company, your employer can change your health insurance every year. I remember when I worked for corporations, pretty much every year there were changes in the healthcare plan. Sometimes they changed from companies. I remember, I think at MSNBC, they changed from Aetna to Cigna one year. The deductible was higher. We paid more in the copays. I believe when I was at the Young Turks, the same thing happened. And to tell you the truth, I can't fully blame the companies because healthcare costs keep rising. So they are having to face a higher share of the burden. And they're passing that off to their employees. I do blame Jeff Bezos because he could afford to give a gold standard healthcare plan. He's just choosing not to because he's a greedy, greedy mother. Boop! Bernie Sanders got in on this ridiculousness of, the media pretending that Medicare for All rips away their choice by basically referencing that tweet I just showed you. Bernie took the tweet from the Washington Post reporter and said, we shouldn't allow Jeff Bezos or any other boss to choose their profits over workers' health care. We need Medicare for all. Bernie! Bringing it, baby! Bernie! Do I have my punch effect? Boom. There it goes. So, this notion that Medicare for All somehow takes away your choice. You don't have a choice. If you get laid off, there goes your health care from your employer. If you're at your employer and your company wants to change your plan where your deductibles go off, mind you, most people don't work at the Washington Post, making, for the most part, journalists there do very, very well in terms of salary. Most people are living paycheck to paycheck. So if your employer at a smaller company than the Washington Post changes their healthcare plan and makes deductibles higher for you, makes copays higher for you, you throw in some co-insurance that they make you pay, well, that could be the difference between you paying the rent this month or getting enough groceries or paying for the medicine and those kinds of things. So this choice narrative is a bunch of, shall I say, from Joe Biden, malarkey. I want to also show you a tweet from Wendell Potter, who is a healthcare whistleblower. He used to work for big healthcare companies and since then has been blowing the whistle on how immoral and basically greedy these healthcare companies are. Wendell Potter tweeted, one of the reasons I left Cigna was meetings about high deductible plans. A consultant was explaining the merits of high deductible plans to us. I questioned how it would shift costs to workers. He got frustrated and said, you're going to have to drink the Kool-Aid. And he tweeted this out in reference to that same Washington Post journalist saying, yeah, Washington Post raising our healthcare costs. So Cigna told Wendell Potter, you're going to have to drink the Kool-Aid when he expressed grievances about these high deductible plans. What this shows very clearly. Oh, by the way, I just want to show you in the Emerson poll from yesterday, I should have mentioned, the Emerson poll from yesterday, 70% of voters strongly oppose employers to be allowed to change or eliminate an employee's health insurance against the employee's wishes. 70% oppose employers changing health care against the employee's wishes. Well, wait a second. I keep hearing from Joe Biden and Mayor Pee Wee Herman over there that the American people want choice. The American people want the choice to keep their employer-based health care. Well, what about this poll that says 70% are opposed to employers fiddling with their health care? Well, all employers fiddle with your health care, from small adjustments to large adjustments. So call me, cynical Susie here, but I'm pretty sure this poll and many others that say the same thing, polls are worded in very specific ways. So a poll could be worded in a very specific way to get whatever answer the pollster wants. So a lot of times polls are worded in a way to get an answer that makes it seem like people are against government health care. And then you could word a poll a different way where people find it much more popular with people to have a government health insurance, government run system. Here's the thing with all this. Not only is companies like the Washington Post showing that this is a bunch of baloney and you don't have a choice with private health insurance industry, President Obama's very own Medicare chief, who ran Medicare under the Obama administration, literally wrote a piece the other day. Headline, USA Today, stop fear-mongering about Medicare for all. Most families would pay less for better care. Donald Berwick, who was Barack Obama's President Obama's chief of Medicare. Credit, I crucify a lot of media outlets. Credit to the USA Today for running this. I won't read the whole thing, but I'll read a little bit for you. With costs rising painfully, insurance companies denying care, and nearly 30 million people still uninsured, America desperately needs an honest health policy discussion. That's why it has been so disappointing over the past several weeks to watch multiple candidates parrot right-wing attacks on Medicare for All, like claiming that it will greatly increase spending on health care or ringing alarms about raising taxes on the middle class. The truth is the opposite. Medicare for All would sharply reduce overall spending on health care. It could be thoughtfully designed to reduce total costs for the vast majority of American families while improving the quality of the care they get. Over my career, I have witnessed the problems with our healthcare system firsthand. As a pediatrician, I have seen how our fragmented, expensive system hurts children and families. Where is CNN and MSNBC breaking news? Barack Obama's chief of Medicare comes out for Medicare for All. Is that not a big deal? Am I in the twilight zone? All we hear is of people railing against Medicare for All, but we don't hear somebody from Joe Biden's administration. Remember, Joe Biden was the vice president. We don't hear, he's not the janitor. He's not some mid-level staffer. This is the head of Medicare and Medicaid for President Obama saying, we need Medicare for all. But no, you don't hear it anyway. Hope you enjoyed that last video. Hop on over to statuscoup.com where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statuscoup.com/join. And remember, join our email list so we can grow the revolution with you.